80 health stakeholders were engaged in consultations today, 7 years after the National Health Plan bill was passed in Parliament, offering affordable health coverage for Bahamians.
As the government awaits the report, the discussion centered around an affordable and comprehensive answer to mounting health costs. We get that story tonight from Noel-Ferguson.
For many Bahamians, adequate health care is unaffordable and could mean the difference between life or death. The government is determined to implement a national health plan to make health care accessible to all.
It's unacceptable that people still die and that people still do not have access because of lack of access to health services.
Powell Representative Dr. Jerry Eckerman noted that the Bahamas is second in the region to move to implement such a plan. Health Minister Dr. Perry Gomez noted that the plan is critical to national development, and although private insurance is robust, he said too many Bahamians either lack coverage or are denied coverage due to pre-existing conditions.
When you get old, they tend to drop you. And again, because of the older you get, the more likely you are to get sick. And they are in the business for profit. And so you see very often people who reach retirement, the premiums that they are charged, they can't afford. They have to make the choice between how they pay for their food or how they pay for their health. And that's the difficulty with private health insurance.
The cost of health coverage is also expected to be made affordable for most Bahamians. It's an issue that Deputy Chief Medical Officer Dr. DeLon Brennan addressed.
We have to provide for quality health services and pay for those services and pay for that access ahead of time. We have to be able to plan for that financing ahead of time so that when people need to come in, it's already taken care of and they don't have to worry about it on the back end.
So whether you make 100,000 or if you make 10,000, it's 5%. You're paying at the same rate. The other thing, everybody is a member and you're all part of something.
Health Minister Dr. Perry Gomez says the plan is expected to come on stream by January of next year, and he assures that health care will be available for all Bahamians. Noel-Ferguson, ZNS Network News.